We have several different arms to our practice, and each arm uses their own specialty forms and templates, so that we of course have customized those things. One of the things that has been extremely helpful to us in dealing with asthmatic patients is that you can set your pulmonary functions, lung function test, or really any laboratory test into the system, and you can then graph it for the patient on the screen and you can print it up.
We don't have to go out and find anything. It's all there in our fingertips.
We do a lot of clinical research that requires a special compliance with FDA codes. For each particular study, we make a template for that study so the correct information is in there. If there are any errors, they can be corrected, and that's all time stamped and electronically signed, and fits all those federal regulations that are required of us.
We got rid of our paper charts almost 7 years ago, and I have to think hard to reflect upon those times.
We have a clinical research arm that deals primarily with all the asthmatic and allergy drugs that are being developed. Each one of those has a very specific set of requirements that and schedule of visits when they come in. And so the system allows you to template something for each specific study so that we can be sure the right information is documented for each particular study.
We're able to be more proactive in taking care of patients and being able to have the system notify us ahead of time. So if a patient, with regards to setting up the parameters, if a patient comes in for an appointment but their next physical or whatever, the pap smear isn't due for another month, the system will actually notify us that at that visit that it's coming up, so that we can take care of it while the patient is here, which then again allows for better patient care on a proactive basis.
We're also looking very closely as to where we can make the medical home, which is the new concept, is that in primary care you are their medical home, which means integration at all levels. And so without this very robust system, we would never be able to do this. So more important than the incentives for us is the ability to really be that medical home.
Outcomes and the pay for performance is the big push in this field. And so again, you can do that as a practice, do that as a practitioner, and set up certain goals and guidelines within your practice, and then use that when you have contracts like the pay for performance contracts.
With the better documentation, our billing staff can then in turn keep track of all these things, and we can find out incredible reports of how well we're doing. Now, more importantly for us clinicians, clinically, because we can run reports on diabetics and what kind of A1Cs we're getting, for example, what kind of blood sugar results we get. We can graph for the patients any lab result and show them and print out these things. And so the biggest benefit that we've had is the ability to do so much with our clinical data and be complete, and the rapidity at which we can do it is incredible. We are utilizing the portal system and electronic systems for inquiries and things, for making appointments. We're pushing that because it is so efficient.
There's a huge change in the patient portal in the fact that the patients can communicate in a secure fashion and you can communicate back and forth. All our labs and most of our path reports come directly into the system, and so it's a one-step process in the fact that you're responding to the task of interpreting that laboratory data and responding to the patient at exactly the same time.
Even though in primary care you take care of a lot of older patients, what we have learned is most grandmas and grandpas and great-grandmas and great-grandmas are very computer literate, and they can get on there and get their data without the cost of a phone call coming in, us interacting with that phone call.
I would say the biggest benefit as far as bottom line is being able to code appropriately. I think one of the biggest issues with primary care, because it's so nebulous, it's easy to code procedures. You did a procedure, you did it. But when you see a patient and most of what you're doing is cognitive work and counseling work, it's a lot harder to know when you've met the criteria and when you haven't. And it's nice to have those guidelines right in the program so you can say, yeah, I did meet this criteria, therefore I can code for that visit appropriately. It just helps us to be able to afford to do what we need to do.
We hope that utilizing all aspects of this, and with our patient management, disease management systems that we've set in place, that we truly can improve patient care. And with practice analytics, we want to demonstrate that. So all this effort is aimed at indeed improving patient care. We're fairly certain that we've done that, and now we're looking forward to, with practice analytics, having the hard numbers to show that we have.
By using the EHR system and using the medicine nomenclature to document those, we were able to calculate the E&Ms more accurately as to what the physicians were actually performing, and so our billings actually went up by about 20% overall.
I would point out that it's very cost effective for physicians, and from a business sense, I don't like to talk much about business, but from a business sense, if a physician is only doing revenue generating things, those non-revenue generating things can be done by someone else.
When the claims are processed in the evening, it goes through the initial scrub, so usually if there's anything right off the bat that was missed, it is caught before it actually transmits out in the evening, so we don't have to wait for the denial to come back. The claims processing turnaround time, we used to be probably at about 60 days on average, some 40, but now our average gross turnaround days is usually around 25 to 28 days.
My emphasis has been on the clinical benefit, but despite the cost and the hours and the effort that it takes, it has had a very positive financial impact. We went into it thinking that we would just improve patient care, and that if we could break even with the cost, that it would be a positive. That would be great. But in fact, it has been a not only great clinical outcome, but a very good financial outcome.